Now recognize the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you, Mr. Chairman, and thank all of you for being here today. This is certainly an important subject. Mr. Chairman, I would certainly be remiss if I didn't join in congratulating you on your new position and let you know how much I look forward to working with you. Gentlemen, as a practicing pharmacist and currently the only pharmacist serving in Congress, this is a big problem that I have worked with closely over the years, and I can assure you that it's no two people are the same. You all know that people react differently, and some people can rehab through little therapy. Some people, it's going to take a lifetime of therapy, and we all understand that. You know, the opioid problem in particular, if we're going to get more specific about a problem, the opioid problem to me is a twofold problem. One problem is prevention. How do we prevent it? And we've certainly talked about that on this committee, and certainly it's one of our concerns. But the second part of the twofold problem is just what we're talking about, and that's those people who are addicted now. I mean, we can talk about prevention, how we prevent it, but what about those people who are already there? What do we do with them? And that's what we're talking about here. Just like every profession, there are bad actors in this area. We all understand that, and that's why we're here today. We want to know how we can help in the federal government to do away with these bad actors. We know that there's patient brokering. We understand that, and we know that that's a big problem. And I guess the question I have for you, and it's a very general question, is just, you know, what can we do from a federal perspective to give you, Mr. Ehrenberg, and at the state level, the resources you need and the ability that you need to get rid of these bad actors?
Thank you, Congressman. I think more than providing money, it's to help us by closing loopholes in federal law
and that's what I'm talking about. Please understand, I'm not interested in throwing money at this problem. I want to know specifically what we can do to help you legislatively.
Thank you, Congressman. Yes, and that's why we're not coming here to ask for money. We're just asking for help in the form of reforming the federal laws that have enabled and exacerbated this problem. You can't attack the opioid epidemic without going after the increased number of deaths from fraud and abuse in the drug treatment industry. Those deaths are preventable. These are people who are looking for help and instead get caught up in the Florida shuffle until they leave Florida in an ambulance or a body bag. And there's stuff that can be done. As we mentioned earlier, clarifying the ADA to allow reasonable regulations at the local level for the sober homes, to change the fee-for-service model of the ACA to a outcome-based reimbursement model. And then Mr. Johnson also had some areas where dealing with the kickback statute. And
reforming the anti-kickback statute and Stark laws so that these safe harbors, you could drive a truck through them right now.
Right,
we see that
right.
with boots on the ground.
And that's exactly what I'm looking for. And what do we need to put in code that's going to help you, that's going to give you the ability to get rid of these bad actors? All of you, I suspect, are familiar with drug courts. We've certainly used them in the state of Georgia. They've been very successful. We've been very pleased with the results that we've gotten there. Just wondering, how do you and your states employ who you're going to use in those drug treatments? If it's a pretrial motion to get someone to go through drug therapy, how do you go about in selecting the company that you'll be using there? Are there any kind of qualifications?
Most of the court-referred cases are Medicare, Medicaid, or other federally assisted programs. Very few are private, but when there is a private one, the court doesn't get involved in picking and choosing where somebody will go for treatment.
They just say you've got to go to one.
Now, we do have a judge, or had a judge, she's just been reassigned, who administered drug court and would only recommend or send people to certified sober homes. Again, no treatment at the sober homes, but the sober homes themselves had to be certified.
So sober living facilities have to be certified?
There's no, not under state law. It's voluntary only, which is a problem.
Is that something we can handle through federal law? Should we require it?
Yes, by clarifying the ADA and FHA to give some comfort to the states that they indeed can have some requirement of certification of the sober homes. where right now they're afraid to do that. They're afraid that that violates, that discriminates against in violation of the FAA.
And I too am hesitant to get more federal involvement in these things. However, I want to give you the tools you need, and it's just a dilemma. And I understand it firsthand. I've seen it firsthand. And
Nobody's asking to open up the FHA or ADA. That's not the ask. The ask is to get DOJ and HUD to do a real clarification, applying the fact that if a resident needs protection, that
I understand. Well, please hear the message. We want to help. And this is a serious problem. And thank you, Mr. Chairman, and I yield back.
Gentlemen, you'll